Okay, how are you going to guide the patient about starting the pills? This is also your exam question and is asked in your OSCE Viva station. Um, that how are you going to guide a patient? That how should she start her pills? Well, you should tell your patient that on the first day of the she should start the medicine on the first day of the cycle and take the time roughly on the same time each day. Then one pill should be taken daily for 21 days, followed by 7 pill free days. The 7 pill free days means that there are 7 pills in the packet which are actually a placebo for iron, and at that during that time the endometrium sheds off and there is withdrawal bleeding, and the second packet is started after the 7-day break directly after the 7 placebo are taken, during which menstruation has occurred. The new packet is starting in continuity with the previous packet and no gap is required. So she has to start her pill, take them for 21 days, then take the 7 pills during which her endometrium will shed off. Actually, that 7 pills are the placebo pills or iron pills, and after taking the 7th pill on the next day she has to start a new packet. What After spontaneous therapeutic abortion, it can be started immediately rather than waiting for start of menses, and after delivery in a non-lactating woman it is better to start on day 21 of delivery, okay, but in a non-lactating woman. How are combined hormonal transdermal patches given? Well, it actually releases 33.9 microgram of ethinyl estradiol per day and norelgestromin 203 microgram per day, and the regimen is same as combined oral contraceptive pills, 21 days of application followed by 7 days hormone free interval. Patch application sites are normally lower abdomen, buttocks, and arm. And remember for your MCQs that the site contraindicated in combined hormonal transdermal patches are the breast, and the site recommended are lower abdomen, buttock, and arm. This is your MCQ. Then combined hormone vaginal ring. It releases 15 microgram of ethinyl estradiol and 120 microgram of etonorgestrel daily. It is self-inserted and worn in the vagina for 21 days, followed by a 7-day hormone-free interval. But female prefer pills other than these two methods, but you should know that what are the other methods. Then moving on to what will you tell the patient about missing the pill? It is also a question repeatedly asked in your exams. If one pill is missed, if the patient has missed only one pill, or if pill taken 24 to 48 hours late, okay, there are two scenarios for this first possibility that either she has missed a pill or has taken it 24 to 48 hours late. Then take the last pill as soon as possible and take rest of the packet as usual. Leave the earlier missed pill. The one pill that she has missed, she should skip that pill and move to the next pill as soon as she remembers, and no additional contraception is needed. There is a SEQ asked here that Mrs. ABC is using OCP for last 6 months. She has missed 2 pills in second row of her OCP packet. She wants help. What precaution will you advise her? As the patient missed 2 pills, take extra precaution condom for next 7 days. How will you start her new packet of OCP if the pill are left in the packet? 7 pills are left in the packet. So I have answered this in the next on the next page. That is, if 2 pills are missed, or if pill taken 48 hours late, more than 48 hours later, then what should be done? Take the last pill as soon as possible and take the rest of the packet as usual, and leave an earlier missed pill. Okay, use condom or avoid sex until 7 consecutive pills have been taken. This is the precautions that you have taken, and this is the method of taking the pill when 2 pills are missed or missed for a time period of more than 48 hours. If missed pills were in week 1 of packet, that is pills in row 1, pills from pill 1 to pill 7, then use emergency contraception if intercourse occur. If the missed pills are in week 2 of the packet, that is pill 8 to 14, that is row 2. Okay, the first one was for row 1, pill 1 to 17, emergency contraception is needed. The second is for week 2, row 2, pill 8 to 14, then no need for emergency contraception. And if the missed pills are in week 3, pill 15 to 21, that is the third row. Okay, this should be very clear to you that what should be done when the pill are missed in a specific row. The first I have explained for row 1, row 2, now row 3. Patient should take pill as soon as she remembers. Directly start a new packet after the last 21st tablet, skipping the 7 days interval without 7 pill free days. Okay, so in your scenarios you are asked quite frequently that she misses a pill in the second row, in the third row, in the fourth row. So I have tried to make it easy for you that what should be done if it is missed in row 1, if it is missed in row 2, or if it missed in row 3. Then moving on to the next question, next part, which is also an important question, that what are the contraindications, right? Some medications are healthy for some individuals and risky for others. So what are the cases that you have to keep in mind before prescribing combined oral contraceptive pills? There are absolute contraindication and as well as relative contraindications. The absolute contraindications are repeatedly asked in your SEQs and as well as are given in your MCQs in a scenario where you are given an absolute contraindications and you are asked that which method of contraception should be advised. If the contraindication is there, if the patient is suffering from ischemic heart disease, then you will never write combined oral contraceptive pills. You will go for option number 2, which is safer in cardiovascular diseases. Okay, then the absolute contraindication, you have to remember this by heart for your MCQs and your SEQs because it is asked again and again. Ischemic heart disease, relative heart diseases, hypercholesterolemia, condition predisposing to thrombosis, post-cerebral hemorrhage, migraine, pulmonary hypertension, acute liver disease, porphyria, history of serious diseases affected by sex steroids, that is trophoblastic diseases. So in these scenarios and in these cases, you cannot prescribe combined oral contraceptive pills or transdermal patches or vaginal rings having both the hormones estrogen and progesterone. What are the relative contraindication? Factors which increase the risk of CVS diseases. Okay, a patient who has cardiovascular disease, cardiovascular risk factors, never prescribe combined hormone pills. Obesity, smoking, hypertension, family history, factors which predisposed to arterial wall disease and sex steroid dependent diseases including cancer and breast cancer. So moving on to the side effect, again an important part of this topic which you have to remember by heart for your OSCE, SEQs and each and every part of your exam. What are the side effects? So you have to divide the side effects into two parts, estrogenic side effects and progesterogenic side effects, because this is how you are asked that what are the estrogenic side effects of hormone contraceptive pills, combined contraceptive pills, and what are the prostogenic effects. The estrogenic side effects are fluid retention from the decreased sodium excretion. There is accelerated development of cholelithiasis. There is increase in HDL and decrease in LDL. There is increase in venous thrombosis, which is the greatest during the first year of use, and risk associated with the dose of estrogen. Higher the dose, higher is the risk of venous thrombosis. There is increase in arterial thrombosis, which is less common than venous thrombosis but is more serious, and risk is strongly influenced by smoking. Then there are progesterogenic effects, that is mood changes, depression, weight gain, acne, breast tenderness, decrease HDL and increase in LDL. What are the association between combined oral contraceptive pills and cancer? Well, it reduces the risk of colorectal cancer, endometrial cancer by 50%, ovarian cancer by 45%, and any cancer by 12%. Reduces the risk of, you should remember two parts of this association: reduces the risk of and increases the risk of. It increases the risk of cervical cancer and breast cancer. So this is all about combined oral contraception, combined hormonal contraception. If you have any question, you can ask in the comment section down below. Don't forget to like, share and subscribe. Allah Hafiz.